Lift and carry a supine patient. Learning to lift and carry a supine patient is important, since 4 of the HILT 6 moves use the same setup steps. The other 3 moves are carry a patient up or downstairs, single person rescue, and lateral transfer. This video has 3 parts. Part 1 will demonstrate how to load the patient onto the HILT in 2 different ways. Part 2 will demonstrate how to lift a patient in 3 different ways. Part 3 will showcase different locations attendants can position around the patient. Part 1. To load a patient onto a full-length HILT, deploy the HILT next to the patient. Log roll the patient and slide the HILT over. Log roll back and center the patient. If desired, deploy safety straps and fasten them around the patient's upper and lower body. To load a patient onto a shortened HILT, fold one end up to the second set of extenders. Shortening the HILT may be desired if the patient is shorter or if setting up for carrying the patient up or downstairs. Log roll the patient and position the HILT's edge just above the patient's knees. Log roll back and center the patient. Deploy safety straps and fasten them around the patient's upper and lower body. Part 2. To lift a patient with a full-length HILT with base handles only, position one attendant at the patient's head and one at the feet. One attendant on each side of the patient will grasp both high-lift base handles. Prepare to lift. On 3. 1, 2, 3. To lift a patient with a full-length HILT with 2 attendants on each side, deploy the first and second sets of extenders at both ends of the HILT. Place hands into the desired extender handles for a low or high lift. Prepare to lift. On 3. 1, 2, 3. To lift a patient with a shortened HILT with 2 attendants on each side, deploy the first and second sets of extenders at the patient's head and chest. Next, deploy the second set of extenders at the patient's knees and the middle set of extenders near the patient's waist. Place hands into the desired extender handles for a low or high lift. Prepare to lift. On 3. 1, 2, 3. Part 3. Part 3 will show some variations for attendant positions around the patient. These can be practiced in preparation for various scenarios. It is important to remember that the larger the patient is, more attendants, up to 14, can be added around the HILT. Other variations are possible, and users should evaluate the best setups for their needs. Be sure to view the elements and infection control videos for additional information.